Welcome everyone. My name is Lynn McEntee and we are welcoming you to Spotlight on Community, a new initiative through Moksha Canada Foundation. We want to say thank you to Moksha Canada Foundation for allowing this program to happen. It is a program to shine out on community resources and people and issues that matter to our hearts. I'll read you a little bit more about Moksha Canada Foundation. We are a non-profit organization and we like to connect, create, and participate and celebrate the diversity of our communities across Canada. We are very excited to collaborate with you, and we have some wonderful guests that have come back to visit us for the second segment to talk about addictions. Be sure to reach out for us on social media, give us a like, let us know if you would like to get involved and if there's any topics you would like us to discuss. This topic matter for addictions is very close to the heart, and we would like to share with you our guest experts today for part 2. We're going to pick up the conversation where we're talking about resources and individual stories and our expertise from our guests here. But I wonder if we could pick up on the different types of addictions, Dr. Ghosh, and if you could highlight for our viewers various types of addictions other than substance abuse.
100%. So, addiction is very complicated, and we've got different definitions of addiction. So we've got like the ASAM criteria, the American Society of Addiction Medicine, that provides us with the criteria.
I think, did we lose our guest?
We did.
He did. He might jump back in again. So maybe we'll just pause the recording.
I'm sure he will jump back.
That's okay. We can edit. That's okay. We can edit.
Yeah, so we'll just carry on. And all right, yeah, so yeah, we're talking about addictions and the different types of addictions and how important it is to pull in all the resources in the community and personalize them because there's not one stamp that you can put on an individual story. So I wondered if we can pick up the conversation from there. Rebecca.
I can. So when we're working with folks experiencing substance use, or even folks experiencing substance use management or any of those pieces, what usually I find is the most successful piece is when you know the resources yourself. So, oh, sorry about that. If you are going to help someone who's using substances, then in that same breath, we have to say, what is it that you need? And usually if we can turn to somebody and say, hey man, what is it that you need? And they give me a little bit of their story about the different things that they need, the different things that they think would help. Because sometimes what we think they need and what they need are two very different things, right? So it's really important to ask those questions. And one of the best things that I have found to assist me with that has been just knowing the resources, knowing the ample amount of resources that are available in my area, so that when I speak to someone and they say that, I kind of have like a file folder in my head. We call it the Rebecca files. And you just kind of go like, and you kind of like look through in your head all the different pieces, and you're like, wait, this program will work for you. This program will get you where you want to go. This program is the piece that you need to tie those two together. And oftentimes you have to use 2, 3, 4 different community resources in order to bring that roundabout care, right? Because oftentimes all of the care that one person needs is not available in one location. So you have to be able to coordinate and branch out and collaborate on that piece. And Monty's back.
Yeah, that's awesome. Welcome back, Monty. Dr. Ghosh, we are talking about, I guess, different types of addictions. We're just starting to pick up the conversation there. I wondered if you wanted to jump in.
Yeah, absolutely. So as I was going before, unfortunately my power just cut off. Is that there's different types of addictions for sure, and the definition of addiction changes depending on what you look at. So we've got the American Society of Addiction Medicine, which has a definition of addiction, which is what I use. But there's other aspects to this as well. There you have the DSM-5 criteria. It looks at substance use disorders. They don't call them addiction anymore in the DSM-5. They call them substance use disorders. And you've got substances that can be addictive, compounds that can be addictive, but you also got behaviors that can be addictive. So the DSM-5, for example, recognizes gambling as being an addiction because it works in the same sort of neural pathways as substances do. But the American Society of Addiction Medicine also has a broader category of what is defined as an addiction. This can include sex, it can include pornography, it can include video games. None of these are actually defined in the DSM criteria. They're looked at as being obsessive compulsive disorders instead. And so we see a variety of ways that we could describe addiction. A lot of them have overlap amongst each other. Some of them don't. We have the ICD-10, which has its own definitions of addiction as well. And so, I mean, it varies. There's no consistency necessarily in what addiction is, although there's elements of consistency.
Would you mind speaking to the overlap for anyone that doesn't know? And is it possible to have parallel addictions?
100%. So, I mean, the overlap that I see often is that there's a loss of control. There's a compulsion to use. There's use with cravings as well. You're craving the use. And last but not least, you're using despite the consequences that exist. So we call them the 4 C's. The 4 C's are so crucial to this. And they all share the same elements of that people, there's consequences that people are still using. They try to control it, but they can't control it. They have cravings to use. They're all very, they all overlap in those respects.
Thank you. Let's see, Kenzie, did you want to jump into any part of the conversation in terms of types of addictions?
No, I think that they
Yep, at this moment. And Rebecca? Yeah, I was, but well, Rebecca, oh, there we go.
I got it.
Yeah.
I think that when we talk about addiction, there are so many different pieces to that, right? And there are so many different things, even things like for example, when you're using substances, some people, I found it a lot harder to exit from using the needle than I did from exiting smoking, right? Like those kinds of pieces of substance use. You can get addicted to just even the motion of it, even the putting together of your item, like even the cooking of it, the burning of it, the filter, like all of those pieces can also become a part of what you need in order to feel what you're trying to feel from it, right? And I think that there's other spaces that are like that as well. There's even things like I don't know. I tell her, I don't know. I go to the same grocery store, man. The same grocery store that I started going to when I first moved to Hamilton is the same store that I go to, and I will drive across town to go to that grocery store because I'm just used to going to that grocery store. And that's what my mind says, right? And it took me a while. Once I moved to another part of town, I was like, you need to find a new grocery store. This is ridiculous. Like, this is 25 minutes from home, right? But I can't, I can't. And when I'm trying to look at like at the gas station, I go to the same gas station. I go to the same, and I think it's just a part of my makeup, right? It's just a part of how I operate and how my brain works. It just likes to take me places that are familiar, right? But if I look at that piece and I look at that in terms of addiction, I can also look at that and say to myself, that's because I feel safer there. I know what to expect. I know what's going to happen. I know how things move. And I know the cashiers. I know the people running the counter. I don't feel nerve-wracked going in there, right? And so for someone who's in recovery the way that I am in my journey of recovery, it's been one of those things that I consistently and constantly go to the same places and use the same things, right? So I don't know. I think addiction is fluid, and I definitely believe gambling is an addiction for sure. And food, sex, there's so many of them. There's just so many of them that you can get addicted to anything. Gaming, digital dependency. We are all addicted to Facebook, Twitter, Instagram. Like, we're all addicted to all of those pieces, right? So being without my phone feels kind of like I've lost an actual, like, my foot or something, right? So and then you're panicked. You're like, where is it? But yeah. So I think there's just so much multitude there, and there's just so many things. And even, I mean, have you seen that show Strange Addiction? There's some really cool stuff on there too. So I mean, I think it's a pretty fluid thing.
Yeah, no, for sure. And I wonder if Dr. Ghosh, if you have a moment to sort of take us back to childhood and when we start to notice, let's just say food, for example. Some people are referring to food as an addiction and can be at a very young age. Could you educate us on that and if it's actually true or not?
You know what? I don't specialize in pediatrics.
Okay.
That is something that I've not really focused on. we do know that, like, I mean, when I look at youth and youth addiction, I think it's a bit different because from what I've read and understood, and again, I'm not an expert in this area, but your frontal lobe isn't developed, as I had mentioned earlier. It's not fully developed, and so to say that someone is addicted might be a less addiction than more compulsion, I should, to use, and more impulsive. As opposed to anything else. As we develop and as we grow, that frontal lobe kicks in, right? Not always. I mean, there's things that inhibit that growth. So they do say that substance use in your adolescence can inhibit that frontal lobe growth from being fully mature. People might have ongoing addiction concerns because that frontal lobe never fully had a chance to grow, if you may, in the right way. So it's really, it's really interesting. Yeah, like is it a compulsion? Is it impulsive, or is it addiction? Really hard to say. Again, I'm not the best expert at this with youth, especially, but I hope I was able to shed some light on that.
Yeah, absolutely, for sure. And I think it's just that it's just touching on it. I know coming from the education field as well, you start to notice tendencies at a very young age, and sometimes in the familial setting too, right? So different things shine light at different times, and as Rebecca was referring to, right? Trauma, for example, things start to surface because of that, and sometimes at a very young age, right? Yeah, and therefore tendencies towards gravitating towards certain behavior. Yeah. Oh, that's interesting. I wonder if you can speak to how important it is for role of the family and role of our communities for resources and all of the things that we're discussing today. Whoever wants to take that on, Kenzie, Rebecca, Dr. Ghosh, Sunil.
Yeah, like, I mean, it goes to what Kenzie was talking about in the previous segment that we had, about supporting individuals and having that social structure in place and dealing with the social aspect of addiction. So just to summarize what we discussed in last segment, we talked about the biological, the social, and psychological aspects of treating addiction. And you have to kind of tackle all three in order to really manage it. And the social structure, the social framework is definitely important. Now, from the clients that I work with in Calgary, many of them are individuals who experience homelessness. They work in the drop-in, or they live in the drop-in center. We try to provide them with social supports through housing and income support. But it goes beyond that. It's about getting the more, it involves getting more granular with social supports. It involves getting them in touch with family, getting them in touch with people that they've thought about in the past and they haven't reached out to. The family piece can be so crucial for substance use disorder. If you're supportive of the individual as a family, as you work through it as a unit, it empowers the individual that much more. Again, it's a crucial aspect of tackling addiction. Now, a lot of my clients don't have that family support there in place. And so you don't necessarily need family. You can have other social supports, whether it's friends, whether it's colleagues, but that the societal piece is so key to ensuring that we have ongoing well-being. And the opposite can happen as well. If you lose your family, if you lose your support structure, if you lose those who are around you that support you, that can drive you into addiction. So you have to have that, you have to really focus on that piece. I'll leave it there.
Rebecca or Kenzie, focusing on that piece in our communities?
So as I said before, whenever I try to set somebody up with a community care plan, right, I try and create a community care team, right? Because you need a community care team. Everybody needs a team. I tell people I need a keeper, but everybody needs a team, right? Everybody needs a team to take care of the different aspects of that care. And when we're dealing with people with, when we're dealing with folks with a substance use management and they are struggling, then you want to make sure that you have a team of care and folks that can help them in each of those aspects. So trying to think of an example. Okay, we'll use me. That's easy because I can't breach confidentiality. It's me. So when I first got out of jail, I had to go to, like, I had nowhere to live, right? So I'd lost my apartment, I'd lost all my supports, I'd lost my pieces, and I was in jail, which made it very hard for my family because they were having trouble accepting the fact that I'd gone to jail, right? So, and accepting the fact of where I was, they had to step back long before that, just in order to protect themselves. And they'd actually had to take kinship of my children. And so I wasn't even allowed at their house at that time, right? Because they had my kids. So now I'm getting out of jail, and I've had an opportunity in jail. Not that jail is an opportunity, just saying. But I had an opportunity in jail to get a handle on some of my some of my substance use management. I've been able to get a bit of a handle on it. And so my dad was able to take me in, right? So my dad doesn't live with my mom, so he was able to take me in. And if he hadn't taken me in, what would have happened to me at that point? So I now do correctional release planning and part of my work. And what happens to people at that point is they just go back to exactly what they know, and they end up in the shelter system. And then we end up in this like huge cycle of recidivism, right? But what happened for me is I was able to tag into that community care support team. So then once I got in with my dad and I had a stable place over my head, I was able to build myself a bit of a team. I was able to get a sponsor. I was able to start going to NA meetings. I was able to go to Here 24/7 was actually who did my gains assessment. I was able to apply to treatment. I was able to do those pieces in my care plan because that's the way I wanted to run my care plan. That's what I wanted to do at the time in order to try and move myself forward. These were the steps that I took. And so in order to take those steps, I had to have a place to stay to be able to do that. I had to have these pieces. And so it ended up being an entire community care team taking care of me and getting myself to treatment. And then once, and don't get me started on treatment. I'm gonna, don't get me started on that. But you know, there's different things work for different people, right? And so it was but that was what I had to do. I had to build a community care team, and that's what we have to do. And for folks that we're supporting in the substance use community, but one of the things in building that care team is the trust factor, right? And that's where peer support comes in so well, is because peer support is kind of that buffer between the street and the service, right? I can go to the service and find out what's going on. I can meet people. I can know that when I take you there, I'm going to know who we're talking to, who we're going to see, what they're going to say to you. I know they're not going to hurt you. I know that they're not going to tell you that you're not worthy. And that is the biggest part in creating your care plan, is finding those services and organizations in your community, going and meeting with them, and knowing that when you bring somebody there, the respect that that person's going to get, regardless of what the stigma is in that situation. So I think like those are kind of like the key points in creating a circle of care and a social support that can kind of like work for somebody, right? I also think the biggest part of that is asking the person what kind of social supports they need, right? I mean, we create these plans sometimes, no offense, Monty, especially in the medical model, where we create this plan, like this is what you're going to do when you leave here, but it's not a plan that they want, right? So we have to have a conversation around that, because if you're doing something you don't want to do, and because somebody told you to, like, it just becomes a kind of like a patriarchal system that kind of doesn't work right. So I think that's why peer support is really important, because I just sit down and have like honest, open conversations with people. I'm just like, what do you need, man? Like, what is it that you need? And you know what? Sometimes it's a coat and a sandwich. And you know what? That's okay too, because when I give you that coat and I give you that sandwich and I tell you that I want you to make it to tomorrow, and I tell you that I love you, and I don't care that you only want a coat and a sandwich for me and you don't want to do anything else, then the next day he's got something else to say, you know. And I think that stuff's really important. It's just building that connection. Kenzie?
Whenever the conversation starts to move towards the idea of community support, I find it really hard not to get really political. So I just want to name that I have a political bias here. I'm not going to pretend that I don't before I say what I say. But I guess, yeah, my concern when we talk about the sort of the role that family or our sort of immediate community can or should play in helping people manage addictions or substance use disorders, is that those units are still operating within a wider political system. And I think because it's operating in this broader context that has a political and social and economic dimension, I think that there's just a limit as to what we can achieve from relying on these more like immediate units. Because it can make a huge difference, of course, it makes a huge difference the role that your immediate community and your family plays in your life, I think. But I think if it's operating against this backdrop of a system that's fundamentally exploitative, I think there's just a limit as to what we can expect those things to do. I think that they're just caveats, like asterisks as yeah, if that makes sense.
Band-aid solutions, but unfortunately a band-aid is better than nothing at all. And that's where we end up going, right? And it sucks. You're absolutely right.
And so yeah, it's I think that with this topic, like it's one of those things that's polyrhythmic, like multiple people are right at the same time, and everything that Rebecca and Monty said, I like 100% agree with. And also there's this, and I don't think that I'm necessarily saying this in contradiction to anything else that has been said here today. It's just.
Mm-hmm. And I was actually addressing what Sunil was asking about before, or talking about before. I said, oh, why can't it start from the top? Sort of a bigger solution than sort of working from the top down, as opposed to the grassroots up. Is that something somebody could speak about right now? Or
I am happy to speak on that. Oh, Kenzie's got it.
I want you to speak to it, Rebecca, but I just want to say that, like, to me, that sort of asks a larger question of like what the top is, because I don't think the top is necessarily like the Canadian government. I think the top is capitalism and colonialism and these sort of larger systems that are operating through time and globally. So that's my 2 cents. Then I would love for Rebecca to take it away.
Thanks, Kenzie.
There's, in order for okay, so like I built an entire organization, right? So I built a charity from the ground up. Okay, I'm using myself as an example here because it's all I got. So I built a charity, right? And at the top of our charity is Pierce, right? So at the top of our charity, our thoughts are always, it trickles down within our charity, right? And then everybody in that charity is harm reduction focused. Everybody's looking at the bigger aspect of things, because when you call our executive director, she's going to say the same thing I'm saying now, right? She believes in harm reduction. She believes in that piece. She believes in where it comes from. And I work in a community, right? So I work in the community as well. And I hold a job at another organization. And that organization is the same. At the top of that organization, the CEO, the executive director, they are harm reduction focused. They think the same way that I do in terms of making things. So I am successful in those organizations and in working in those organizations because at the top, it really trickles down. So you might meet somebody there that maybe isn't harm reduction focused, but you know, if you call the executive director and say, hey man, they did this and that's not okay, the executive director is going to be like, no, that's not okay, right? So you have that option calling into the top and being like, hey man, this person who I've met down here who doesn't understand what we're doing, we need to have a conversation with them on how to do that differently, right? So if you're working somewhere and you're trying to do something and the top agrees with you, it makes it a lot easier for you, right? When we talk about the government and we talk about like our prime minister, we talk about those pieces, and we talk about like sort of like a larger capitalism, we talk about the larger colonialism in itself, like to really actually be able to have it trickle down, we need to talk about things like our court system, our justice system, our police system, what our police system was created for, all of these pieces, even if we're talking about the jail, right? Like jails in itself are self-governing. What happens in jail happens in jail. And there's no recourse for that. Like you can't get out of jail and then sue the jail for the abuse that they brought upon you, right? Yeah, it doesn't work like that. So this is the problem, is our system in itself is just so messed up at the top that there's just like, what even is the top and how does it trickle down, right? So like, I think it's like a bigger systemic problem that just is just overwhelming. And so we on the front lines of this, and I've been saying this since COVID started, masks on the face, boots on the ground, right? And that is what we're trying to do. We are trying to, we have boots on the ground. And if you've got boots on the ground and you're working with these people in that space, then you know that the system is trying to mess it up every step of the way. Every time I start to get 2 feet forward, we end up going 7 feet back. And as a worker, you're now standing with them in that cycle, and I'm pushing and pushing, and I get more traction because I'm a worker, right? But when I was when they saw me as only as a substance user and not as a worker, I couldn't get far. man. I couldn't. So now I have to advocate for those pieces, and I have to push for people to do that. There we have in Hamilton a social navigation department, and that's the police department that assists with homelessness and substance use. And what I say about them often is that they use their uniform for a different space, right? They use their uniform to do good for me, to push me through these systems, rather than using their uniform against me. And that is exactly what we need to find in our bigger systems and in our bigger pieces, right? Like our prime ministers need to be standing in front of us going, no, we're pushing safe supply through, right? We are pushing decriminalization through, and they need to be our beacon of light to do that. And it's just not there. It's just not there. So it's hard. We have to do these Band-Aid solutions for now. And it sucks, but at least the Band-Aid solutions keep people alive for a few minutes longer in the hopes that we can maybe change the system, right? I mean, honestly, at the end of the day, that's the point. I just got to keep you alive until I can get the system to change.
Kenzie?
I think that's sort of, to me, the thing that I love about harm reduction, and what really inspires me about it is that harm reduction definitionally recognizes the limitations of what we can do within this larger context. Like maybe the three of us that are here cannot personally ensure safe supply for everybody across the globe, but what can we do? Well, we can connect people when they're vulnerable with resources. We can create peer systems. We can get them things that they know that they need, and use the resources we have to connect people with those asks to make sure that those needs are met. And I just think that's something that really like inspires me about harm reduction, is it sort of is entrenched in this ethic of kind of disobedience, but I would say compassionate disobedience, like understanding the limitations of what we can do and being like, well, we're going to do something anyway, even though there's like everything sort of working against us.
Yeah. Does that speak to your thought there, Rebecca, as well? We're going to do something anyway, despite everything else.
I was just yelling, right? I was just yelling, like, right. Like, she's so right, man. Like, where everybody's like, every system is against you here, man. Every system is against us. And I was just like, that's literally how the original overdose prevention line, which was the provincial one, was born. As I was sitting in a meeting, and everybody was like, well, we need another PowerPoint, more data. And I was like, and I just like threw my file folder, and I was like, you know what? I'm just going to do it. I can't, man. I can't. And now we're here, right? So, I mean, I don't know. I'm a bit of a cowboy. I'm working on it.
Yeah, for sure. Changing one mind at a time. Dr. Ghosh, I wonder if you can jump into sort of what Kenzie and Rebecca are referring to, really. Despite everything else, people are trudging on and making change and trying to pull in resources, as difficult as that may be sometimes, but to celebrate the good that is being done.
So, I mean, I'll look at it through two different vantage points. One is just as a person in society, and harm reduction is just love, really. It's love for people. It's love to help. It's love to show them support wherever they're at and with whatever they need. And that's what it is. It's just love. Now, from a public health lens, putting on my physician hat here, it makes sense, right? We've seen data that shows that harm reduction reduces HIV transmission rates. It reduces Hep C transmission rates. We know that it helps save lives as well with naloxone kits and distribution. From a clinical lens, it helps bring people down the path of wellness, right? It's all about wellness and having overall wellness, whatever that looks like for the individual. But it again goes back to wellness. And then getting society and working with the complex systems is what public health is all about. And there's limited, one thing that they've taught me in school is that there's limited windows of opportunity with public health to change things. And you have to kind of wait for that window of opportunity to occur and to open up. And the opioid crisis has opened up a window of opportunity to deal with substance use concerns in a different way, whether that's trying to get the social justice system to shift. Because, back in the 80s during the Reagan era, we were all about criminalization, right? You enforce substance use concerns. Like you deal with substance use concerns by enforcing, throwing them to jail, by criminalizing it. We know that's not working, and the opioid crisis has taught us that. That is a perfect opportunity to shift that, right? We know that that like harm reduction was not accepted back in the 90s and the early 2000s. It was a four-letter word. In many respects, it still is. Not everyone understands it. But now we have a window of opportunity where public health is actually finally grasping onto it and supporting it. So like I think there's lots of windows of opportunity right now. Yes, the opioid crisis and the epidemic has cost many lives, but I think it's finally focused the attention of substance users, and now it's a golden opportunity to make shift and change happen and continue to push the frontiers of what this means and how we can support others. And again, it boils down to the fact that substance misuse is just the same as any other disorder or disease process out there, whether it's diabetes, high blood pressure, you name it. We need to support these individuals. We need to treat it like a medical diagnosis. We need to treat people as people. They're not defined by their diagnoses, and yeah, tread ahead.
Kenzie or Rebecca? The love component?
If there's one thing that I can say, it's that we will use anyway, right? So this is something that I kind of like bring forward when I'm talking to, when I'm doing like conversations with any kind of maybe a slightly more oppressive friends in the community, and or slightly more oppressive organizations in the community, right? And I'm having the conversation with them. My conversation turns sometimes to people saying, you know, I don't want people using substances in my hometown. I don't want them using it in my backyard, right? There's been this whole thing, not in my backyard. I don't want homeless people in the hotel next door to me. Like there are all these pieces that come down from that, right? And when I look at that, I always, when I'm in the conversation, and I have to remain kind, which is not always easy for me, I'll be honest, but I have to remain like kind, and I have to be like, and I have to see it from their point too. And so one of the things that I really use in that piece is we will use anyway. Whether you provide us with safe needles, whether you provide us with a safe injection site, whether you provide us or give us things like NORS, things like Brave, whether you do those things, right? Whether you give us food, whether you do any of those things, we will use anyway. So we will be using in your backyard regardless. If you have a safe injection site in your backyard, at least you know that you're not going to walk out your back door and find us there. Do you know what I mean? And your kid isn't going to have that trauma either, right? So like by putting these things into place within our society, what we're actually doing is we're actually helping ourselves as well. It's not like a safe injection site in your community doesn't just help substance users. It helps you, it helps your kids, it helps your entire community to be able to move more effectively because they have a place to go where they can access clean supplies. And when we talk about clean supplies and we talk about syringe needle exchange, we have to also talk about how much it cuts down on the spread of infection within your community. And right now we're seeing a global pandemic. I would be like, safe needle exchanges must stay open. It's a global pandemic, man. We can't be sharing. You don't know how many times I've had to yell during this pandemic, yo, man, don't share your meth pipe, bruh. But it's true. It's this like, you know, it's this piece of the pie that we kind of miss out on when we're trying to, that I think like these sort of more like a different community ways of thinking, right? And people think that having a safe injection site lowers their property value, but it doesn't. It heightens their property value because now you have somewhere that is safe for the people that are using substances in your community. And the reality is they'll be using them anyway, right? Like you can't, you won't be able to control that. We've tried. They've tried prohibition, the war on drugs, jails. They've tried. It doesn't work, right? It doesn't work. We're using anyway. So we have to come to a different system and a different way of doing that. And love and harm reduction is that way. What we do with harm reduction and what we do with the love that we show the people we work with is we say, hey, man, I love you anyway. It doesn't matter. Whatever you're doing, I love you anyway. And that makes a difference. I had a gentleman who was, and he would be okay with this. I had a gentleman who was, who was living homeless, using substances. I had seen him numerous times. I'd worked with him in a safe injection site, worked with him in different spaces. And the one day he came up to me in the middle of COVID and he said, I can't do it anymore. I haven't seen anybody, I haven't talked to anybody, like I can't do it anymore. Right. And he's like, I can't be a part of this anymore. And all I want to do is be gone from this world. Right. And at that point, we moved into a situation where he was for sure talking about how to use substances in order to complete suicide. Right. And at that point, what I did is I hugged him. And yeah, it was the middle of COVID. And yeah, it wasn't, it was, downtown in the middle of a, rainstorm. But I looked at him and I said, you know what, man? And I hugged him and I gave him some naloxone and I gave him the NORS number and I gave him a sandwich and I gave him a coat. And I said, hey, man, I hope I see you again tomorrow. I love you, And he said, that moment, and then I saw him 2 days later and he's like, that's the moment when it switched for me. And I was like, I don't want to miss this piece. Right. And I think that is really honestly what harm reduction is all about. It's a freaking hug in the middle of a hailstorm, man. And that's what we need to be doing.
Oh, that's beautiful. Really, it is just that is the myth busting right there. I think, Kenzie, we spoke about the myth busting before, and that's it right there. You break it down. It's really basic human connection. And that's really that somebody gives a hoot, right?
Yeah.
And they see you. I see you, and validates you or individuals as a person, right?
Yeah.
Yeah. No, that's beautifully put. Sunil, question, or Dr. Ghosh, if you wanted to hop in, or Kenzie. And I think, no, go ahead.
The joys of Zoom. I was just gonna say, I just wanted to add that. And I'm curious to know if the others who are here with me have also noticed this happen. But one of the things that I think reemphasizes the importance of myth busting and education as being really central in the harm reduction movement is one thing that I've observed is whenever people bring up this whole thing that Rebecca's saying about not in my backyard, if you ask them why, they almost always say safety concerns, or they almost always cite safety concerns. It's always this ridiculous fear of being chased with needles. I don't know why that's this recurring imagery that people always bring up, but anyhow, when they actually list their safety concerns in these conversations, and then you point by point explain how harm reduction better achieves those safety concerns or helps address those safety concerns better than criminalization or abolition would outright, you realize that it was never about safety because they maintain their position, seeing the data, seeing the facts, seeing that harm reduction does a better job than abolition or than it ever could. Is when you start seeing that a lot of people's opinions about drug laws are not ever based on safety, and they weren't ever based on safety, and making it about safety is a sort of convenient way of not really having to say the uglier truth, which is, I think, just bias and prejudice and all of those things. I think I just, whenever we have conversations like this, Rebecca shares the things that she was just sharing, I'm reminded of the really important half of the work that Rebecca is doing all the time, which is the education piece, the myth busting piece, to ensure that people are sort of more willing to adopt harm reduction as a practice.
Dr. Ghosh, I wonder if you could speak to just that in terms of being mindful of keeping those frameworks in place as we sort of move forward in our society, and how important it is to address that and myth bust, if you will, and just really get down to the nitty gritty of the direct needs of each community.
That's a very that's a large question. So there definitely is a need to myth bust for sure. I think the medical field can definitely help with that. And as we're understanding what addiction is more and more through research and science, I think there's a certain aspect of society that this will really help with, right? Those who believe in science, those who believe in policy built off of science. I think those would be the groups that are really be early adopters of understanding that there's a lot of stigma, that there's a lot of myths surrounding addiction. But I also think there's always going to be an element of society that won't necessarily believe that, especially those who hold on to tradition, those who hold on to those who are maybe spiritual in a different respect. I think, And that being said, not all spirituality is falls along those lines, but I do think that that it's very important for us as a society to push forward with understanding substance use concerns more. Now, in terms of how that penetrates through society and how that impacts communities, I think it boils down to policy building and changing our legal system. And it has to come from the top down. You brought it up earlier that some of it is from the ground up as well, from the grassroots movements. But I do think that that really, if you really want to impact every part of society, you really need to have broader policy reform. And but that takes time, and it takes it happens inch by inch, degree by degree. By step, before you know it, you look behind you and you're kilometer ahead of where you were 2-3 years ago, right? But it's step by step. It's a slow. It might seem like a slow process, but things do move forward.
That's beautifully said. Oh, Rebecca, Kenzie. Oh. Yeah.
I can jump in there. I was waiting. I thought Kenzie might jump in. I think it's great when we see communities come together. That's, I'm just super excited about it, and being able to work on projects like this with a collaborative space and being able to offer different things is really amazing. I've really enjoyed working with Brave, and I've really enjoyed working with Monty. I worked in the medical model for a while, creating peer support programs in their inpatient mental health and their ER, and it's an uphill climb. So, when Monty talks about harm reduction, and Monty talks about how he manages in the medical field, know that Monty takes a lot of flack for it, man. He takes a lot of flack for it, for standing up for people who are in substances, for standing up for people in mental health. He takes a lot of, and even from the peer world, which is hilarious to me, because people in the peer world, they're like, well, if you're not a peer, then you don't know what you're talking about. And I'm like, okay, but he's a doctor. Like he has other things that he knows about. And I don't think we need him to start doing drugs just to get him on this side, guys. There's these pieces, there's discrimination and discriminatory pieces that happen with everything, and stigma that happens with every piece, right? And our stigma is well earned, our stigma that we have towards the medical model and our stigma that we have towards police, and all of those pieces are well earned. They are well earned. So he fights in many different arenas to try and get his voice heard, and I really appreciate that.
The same thing about you, right? It takes a village to change things, and a lot of what's happened is because of Rebecca and groups like Grenfell and peers rising to the occasion and expressing their voice, which is something that was frowned upon before, right? Society, I think, has actually tried to suppress the voices of those who are using substances, and I'm glad that things are moving ahead, where the voices of those who have lived with substance use concerns or are currently living with substance use concerns are there to speak their truth, to educate society, to educate physicians. I learned half of the things that I learned off of people with lived experience, more than half. And it's important to have that dialogue, right? How am I going to treat someone if I don't know who they are, or hear their story, or understand where they come from? Addictions, it's much more complex, as Kenzie had pointed out. It's biological, psycho, and social, and I need to learn about all three. I need to know where they came from, who their family is, what trauma they've experienced in the past, what triggers they have, which community they live in, what community supports are around them. I need to know about their depression and anxiety. I need to know what medications they've tried before to deal with this and haven't worked. It's not a one-size-fits-all model. But I think as a general message and a piece of advocacy, we need to continue to empower the voices of those who are using substances and make them the prominent voice in our society, and let them dictate to us and tell us what they need to support them.
Hear, hear.
Nice. And that's a hear from Rebecca as well, too. Wow, where do I go with that? I wondered, we kind of just wanted to touch on the COVID period and just moving forward post-COVID and the support systems that are in place. And also another one was cross-culturally, if anyone could speak to that. I know that that's someone's come up before in terms of a question and accessibility for communities. Does anybody want to tackle that one and how things have been during COVID? And then cross-culturally in our communities.
Okay, that's a big one. So, well, COVID has wreaked havoc on our population, like on all the people that we serve, and honestly, that's across the board. It doesn't matter. Like it's wreaked havoc on people's mental health. It's wreaked havoc on our youth. It's wreaked havoc on our substance users. It's wreaked havoc on our medical professionals. It's wreaked havoc just across the board, right? COVID with it brings just so many different aspects. There's tons of things I learn every day too, like that I don't even think about. Like this is totally off topic and I swear I won't stay on it for long, but like I was listening to CBC the other day and this guy is trying to like control COVID in the gorilla population and he sounded as tired as I feel. Like he, you know, and these are things you don't even think about, right? Like I wasn't thinking about the gorilla Amazon population and how COVID affects them, but these are pieces of the same puzzle, right? It's just affecting so many people on so many different levels all across. And I couldn't even begin to imagine everybody's personal problematic situation with COVID, right? Like I can't even begin to imagine. So I think COVID has just been a learning curve. The one thing that COVID has brought about that has been really positive and is that they are seeing more and more and more that we need to address the homeless situation, that we have a huge homeless situation, that they need to address the substance using situation, and that we have a huge substance using situation. So both of those are undeniable at this point. So even at the highest levels of government, they cannot deny that we have some serious issues here, and they have opened up more towards harm reduction in this model as well. So I have to say that like, that has happened, but it's been out of desperation. It's been out of desperation and not enough has happened to make it okay. And not enough has changed, right? Like they should be, bam, decriminalization, bam, safe supply, bam, safe needle exchanges, open, right? Like they should be doing this right now because they're seeing what's happening, but they're not. And that is hard on our using, that's hard on us, right? Like I sit here and I think to myself, you can do all these things because COVID affects you. So you can shut down the city. You can shut down all of the businesses. You can circumvent FDA approval in order to get the vaccine out, and you can't decriminalize. Like you can't give us safe supply. Like we lose more people. We've lost more people to overdose than we have to COVID. And I'm unsure as to why those pieces aren't in place. But the reality is it's because the people making the decisions don't feel it affects them. Right? So it's painful. It's painful for us to watch as people in the community that are fighting for things. It's painful to watch, right? So I think that that's kind of the piece about COVID for me is that I think everybody's struggle with it is different, but I think the government's like refusal to acknowledge that these pieces are there is a piece that is so difficult to take, especially with all the things that they're able to do with COVID, right? They're like, oh, this is a big deal. And I'm not in any way saying COVID isn't a big deal. It's totally a big deal, but they're able to put all these things into place, right? And I'm like, why can't you put some things into place to protect my people too, you know? So I think that there is a lot there in terms of COVID. What was the second part of that question? Oh, it was the big one, the cultural one. Okay, so in terms of cultural accessibility, one of the things that we really try to do at Grenfell, at NORS, at Brave, and basically in everything that we do, we really try to encourage and make sure that our services are acceptable and providing the right things culturally for everyone, right? So we really try hard to make sure that that's what we present. And we really, when people go through the training to be on the NORS line and things like that, part of the questions that we ask them are things like making sure that there's no racial bias there, making sure that there's nothing happening there for someone that maybe is trying to come on the line as a volunteer, but actually hates substance users, you know, like we really try to weed that out and to make sure that the people picking up the line are full of love in a diverse fashion. So those are the pieces that we can do. Do we need to do more? Yes. So much more. To truly support the communities, we need to be out there and we need to be advocates for change in those communities. Man, we need to be standing at the front lines of advocacy for change. We need to be out there with everything we've got. We need to have boots on the ground at every single place that we can have boots on the ground for, to make sure that we're pushing these policies forward. We need to stand shoulder to shoulder with those communities, and we need to walk through that. And that is what it really is about. And so my hope with NORS and my hope with Grenfell is that we're building a community across Canada that is going to be powerful. And I'm hoping that with that power, we'll be able to execute great change in our cultural communities. And that is my.
Wow, is that your call to action?
Yeah, it sure is.
Absolutely.
Mask on the face, boots on the ground, phone on the air. Let's get it.
Big time. Wow, beautifully said. I think we need t-shirts. Right?
I want t-shirts.
Right? Nice. That is awesome. Thank you so much, Rebecca, for that. Dr. Ghosh or Kenzie, what you could you add to that?
From my practice, what I've seen. So in terms of COVID impacting substance use concerns, there's definitely been an increase. And the more that we progressed along the pandemic, the more and more I see it. So anecdotally, when I talk to my patients and I talk to them about their drinking history, and I asked them where that pivot point occurred where they felt that their drinking was going out of control, almost invariably for the last while, it's been about COVID. It's been that they've been unemployed or they've lost their employment, they're more at home, they were before, they're bored, they don't know what to do, and they're drinking more, or they're using substances more. Or the stress of life has that, especially because of COVID, has put on them, has caused them to use more substances. And we're seeing this trickle in other aspects as well. So for example, there's less services available now than there were before to support these individuals. Many of them require physical distancing. So like, for example, if you need to get welfare, a lot of the welfare offices are closed and you have to either call in or go online and register to talk to someone. And that doesn't work for everyone, right? People don't have phones necessarily, especially the ones who do need welfare. And so, and it's very interesting. Supervised consumption sites, you see that they're down by capacity by 50%. Addiction treatment facilities, down by capacity. Detox facilities, treatment programs are all virtual. There's an element that's lost with virtual care that could have been there with in-person care, right? You lose this sort of body language aspect that you can sort of understand where the person's coming from. You can see if they're not telling you the truth, or they can tell if you're not telling them the truth, or you're not being authentic to them. A lot of these elements are gone. And so it's going to be interesting to see how this progresses as we go through the pandemic. But there's a vaccine out there now. I'm hopeful that there is light at the end of the tunnel.
Nice, thank you. Thank you. And Kenzie?
I don't have that much to add. I feel like everybody else covered it pretty well. But I guess just one thing I would elaborate on a little bit is that COVID basically proved people who use drugs right on every drug-related policy issue, including the need for safe supply and increased social supports and all of the other things that have been mentioned here today. Because COVID exacerbated all of these factors that contribute to overdose risk, it made the quality of the supply worse, it increased use in isolation, it decimated social supports for people. And what we saw was a massive increase in overdose. And COVID basically subjected us to a population-wide experiment that showed us that, yeah, these are the variables we need to address. And those are the variables that people who use drugs have been telling us need to be addressed until they're blue in the face at every opportunity for years. And so I think it just sort of, it's pretty abhorrent that it took COVID for people to start saying like, oh yeah, I guess we do need safe supply, huh? Like it shouldn't take doubling, well, not quite doubling, but like massively increasing the rate of overdose fatalities for people to finally start listening. But yeah, I think this is just to highlight what other folks have also been saying here today about the need to be always putting the voices of people who use drugs at the center, because people who use drugs know exactly what they need and exactly what will work and exactly what won't work. And I think that like others have also said, it's high time that we start listening.
No, that's the key we're holding right there. I wonder if we can ask any questions from Sunil at this point before our guests. No, I think we've covered everything that we wanted to cover in this portion of our programming. And I'm just honored that you were able to be here for the first segment, but also the second segment. And for anybody who wants to get involved, we'll put up all those links onto our website as well, if they wanted to reach out to Kenzie or Rebecca or Monty, any other orgs that they're affiliated with. I want to thank you all for being here today for Spotlight on Community. My name is Lynn McEntee. We have been talking about addictions and educating ourselves from our expert guests. Thank you to Moksha Canada Foundation for allowing us to do this and shine light on a very important topic, and to shine light on our guest experts as well. Reach out to us anytime. And any closing comments from Rebecca, Monty, or Kenzie before we wave off?
I just want to say thank you so much for having us, Lynn, and thank you for shining a light on this topic. And I just want to include that you can download the Brave app at the App Store, and that's the Google App Store or the Apple or however it works, all of those. You can download them from every app store. I'm not an iPhone user. I'm like any app store. You can download Brave, and you can also get it on your computer as well from the website. And the number for NORS is 1-888-688-6677. And if you would like to reach out to Grenfell Ministries, you can reach us at info@grenfellministries.org. And thanks so much for having us, Lynn, and thank you so much for hosting. And thank you to Sunil for being here too.
Thank you so much. Beautifully said. I'm getting my boots on and I'm strapping those on. Right. Nice. Thank you to all. Any other closing comments? Otherwise, I'll sign off and say thank you so much to our viewers for being here and our wonderful guest experts. Spotlight on Community, Moksha Canada Foundation. See you again. Bye-bye.